So my name's Pete Griffith. I am chaplain for the hospice as well as for the hospital. So chaplaincy for me covers pastoral, spiritual and religious care, both within the hospice and the hospital environments for all patients, staff and families. I think for me it's honesty and directness is the best approach. Certainly at the point of end of life, there's no point talking around difficult issues. So I tend to find that the direct approach is the best way. And for me, communicating with a patient, I would first introduce myself, tell them what my remit is. Often I'll get the feedback straight away. I'm not religious, Pete, and I share that actually I understand that, and a lot of people I talk to aren't. But we all have that spirituality bit of us, those things that are important to us, and when we're in hospices or hospital, we're denied those things. It might be family, it might be our pets, it might be the things that we used to be able to do at work, being able to go for walks, so enjoying the outdoors, that are suddenly denied us in an instant, really. So it's reconnecting them back to those things. Often, tell me what's important to you, and finding out about those things. I think for families, obviously, they're at that point of often very late diagnosis for their loved one, and so there's a lot of emotion, often sometimes more emotional than the patient. And so for me, it's hearing first. The first and most important thing for me is listening, and so be listening to their challenging conversations, and then be that pastoral role, really just coming alongside them. Obviously as a chaplain, as I can't take it away from them, and as a hospice here, we can't take away the awfulness of the moment, but we can listen, put an arm around them, and walk alongside them. And that's our promise, really. And for me, it's so important just to know that they're not alone, to be with them in that journey. As I said before, really, it's very direct. So I would talk around, dying. Do you feel prepared? Are there things that you feel you might need to say to the family that you want to communicate? Perhaps often there's that sort of underlying thing of things not being said, actually. And for me, trying to encourage families to say those important words, to have the important conversations around the hospital bed. And that goes for whether the patient is conscious or unconscious. I think we know, don't we, that patients, the last thing that they will have as one of their senses is hearing. So we feel it's really important to continue those conversations even when the person is no longer conscious. So for me, yeah, communication is key. Yeah. Yeah, I think sometimes you might need to prompt. So have you considered, what the loved one might want for, or if I'm speaking to a loved one, have you considered, for your funeral, what you might want? And again, it's just giving time. I think the most important thing we all have is time, and I think it's building up trust. So certainly within the hospice environment here, families. Some of our families are in and out very quickly, as we know, but sometimes they might be around for some days, and sometimes occasionally weeks. And so the more that they know that we're here for them, that they can count on us. So yes, it's gaining their trust sometimes, and that if it's a short conversation, or we know they're going to be with us for a short time, trying to gain their trust can be difficult. But I think actually people are very open at this point in their lives, where either the loved one or the families are more open than they might be in a hospital environment. The fact that we have time and space here for peace and quiet is really important. We find that each patient having their own room or the garden or places where we can have those difficult conversations is key, so they can have that conversation in a private space.